The latest statistics from the American Cancer Society estimate close to 11,000 women will be diagnosed with breast cancer in North Carolina this year. Early diagnosis key to their survival. And with new guidelines on routine mammograms coming out, we invited Dr. Patrick McGuire, radiation oncologist with Novant Health Zimmer Cancer Institute, to join us to talk a little bit more about that. So thank you so much for coming in.
Yeah, my pleasure.
Now, the new recommendations moving from those routine mammograms at the age of 50 to the age of 40, that's a big difference, 10 years. Why the change?
Yeah, so the panelists will look at studies every few years and say, hey, what's the data show? And for the most part, earlier diagnosis, particularly in higher risk groups, is critical. So black women, younger patients tend to have more aggressive cancers. And so by starting diagnosis at 40 instead of 50, we'll pick up several more diagnoses for every 1,000 or so patients screened.
And I know continued research and continue analyzing of data is important for women's survivals and prevention as well. And I understand you're part of a research study.
Yeah, so at Novant New Hanover, we collaborate with other docs, and particularly our academic partners at UNC are they and we are running a trial that looks at patients who have lower risk breast cancer. So patients who are 65 and older who have earlier cancers. And the standard of care is surgery, and then usually patients will get adjuvant treatment with either hormone pills for 5 years or radiation. And quite often both of those work together and both can be helpful. So this trial looks at those patients and says, hey, these lower risk patients, should we just do radiation or should we just do the hormone pill?
Okay.
And then looking at their quality of life.
Oh, interesting.
Yeah.
And the trial underway right now?
Will be shortly. And so they're hoping to put, I think, 90 to 100 patients on the trial. And so we're hoping to, play a big part in that trial. And
how would women know if they're eligible for this?
Yeah, so when they come to see me or my partners or our colleagues in medical oncology, we'll be speaking to them. We have a multidisciplinary group that meets every Monday, and so we see patients there together, the surgeons, the medical oncologists, and the radiation oncologists, and so we talk to patients then and would let them know if they were eligible.
All right, interesting. We'll be interested in seeing how that works out as well, the results of that. Thank you, Dr. McGuire.
Yeah, my pleasure, Kim.